Well, good afternoon. With the case numbers on the rise, we all have to stay vigilant because we all have a role to play. Last week, we released our $2.8 billion COVID-19 fall preparedness plan to fortify the front lines of our healthcare system. Back in July, we released our plan to get kids back to school safely. We have a $1.3 billion plan in place to keep our kids safe, keep our teachers safe, and staff as safe as possible in every classroom in this province. We've hired over 600 new nurses for our schools. We added 1,100 new cleaners in our schools and invested $234 million to hire more teachers and staff. We delivered over 37 million pieces of PPE, masks, gloves, and other critical supplies to schools. We've spared absolutely no expense when it comes to protecting our kids and school staff because we're committed to fighting COVID-19 with everything we've got. And schools have been open for weeks. The principals, the nurses, the teachers, the parents and staff, everyone has been doing a tremendous job to keep the classrooms as safe as possible. And it's thanks to their collective efforts that the cases remain relatively low. It's thanks to all of you that the system is working. When there have been cases, the system has kicked in immediately. Parents have been notified, individuals have been isolated. My friends, the system has been working. But we can't take anything for granted. We know there are certain areas of the province that are seeing higher community spread. The schools in those places, they need some extra support. So that's why today I'm announcing more support for schools in hotspot communities. We're authorizing an additional $35 million to help schools in Toronto, Ottawa, Peel, and York region. This funding will help provide more physical distancing in classrooms, support smaller classrooms, and provide more resources for remote learning. For example, schools can use funding to buy more laptops, tablets, or other devices for online learning, or hire more teachers and custodians at schools. This funding builds on our comprehensive back-to-school plan to ensure classrooms can stay open as safely as possible and students continue to learn. And I want to take a moment to recognize all the parents out there. You've been absolutely incredible when it comes to keeping our schools safe. We couldn't do it without you. Because when it comes to keeping our kids safe, we're all in this together. We all need to work together now to keep everyone safe and healthy. And if we stick together, we will get through this. Thank you, and God bless the people of Ontario. Now I'll pass it over to Minister Lecce.
Good afternoon. There is nothing more important than the safety of our students. Let us reflect on the incredible strength of our plan to get kids back to school safely. We've ensured that all students could safely return to class, whether in class or online. We're also cognizant of the fact that rising cases within our community can enter our schools. It is why we're doing more to reduce the risk so that we can keep our small businesses, our schools, and our society open. Notre plan a été approuvé par le médecin hygiéniste en chef de l'Ontario. Ontario's Chief Medical Officer of Health contributed significantly to the development of the back-to-school plan. Our plan is fully funded and evidence-informed, and it has two aims. The first is to prevent the spread. We've equipped our boards with the funding and staffing and PPE required to do just that. Well over 2,000 net new teachers have been hired, over 370 new ECEs, over 600 new nurses, over 1,100 new custodians in our schools, over 150 new EAs and 92 mental health workers new in our schools, and over 120,000 new devices have been purchased to enable remote or online learning. Now, our second aim is to respond rapidly and decisively when cases emerge. When a cohort is sent home, we have instructed boards that they must swiftly switch to remote learning within 24 hours. And we're grateful for the swift response of local public health, working with our school boards and our parents to implement the protocols and to stop the spread. Now, we know that flu season, the second wave, is upon us. This province is ready to bolster our plan and to strengthen safety in those targeted schools. And for that reason, our government is acting and investing an additional $35 million to protect schools in high-risk communities of Toronto, of Peel, Ottawa, and York. Our government is investing more to reduce the risk. Notre gouvernement réalise davantage d'investissements pour réduire les risques de propagation. To put these dollars in context for the Toronto District School Board, who's receiving an additional $9 million in extra funding, they'd be able to hire more than 120 teachers, or 100 more custodians, or 11,000 more technological devices. All boards, English and French, public and Catholic, are receiving funding to these targeted areas. Now, today is also World Teachers' Day, and they deserve our gratitude. Our educators have risen to the challenge. Nous tenons à remercier toutes les enseignantes et tous les enseignants de l'Ontario pour leur travail acharné. While we face challenges as a province, along the way, let us remember to be kind, to be united and focused on our efforts to reduce the risk. Thank you.
We'll go to the phone line for questions.
Ivana, I want to wish all our great teachers out there a happy World Teachers Day. All of you have been absolute champions. You really stepped up in keeping our kids safe. So I want to thank you.
First question, please.
First question comes from Chris Lecce from Toronto Star. Please go ahead.
Hi, Chris.
Hi, thank you. My questions are actually for Minister Lecce.
Yep.
I'm just wondering, the Toronto Catholic Board and others, I'm sure, they're employing itinerant teachers for French, music, and gym. They've recently had a few cases where these teachers, they visit up to 10 schools a week, and they've forced the closure of a number of classes because of exposure to COVID. And I'm just wondering, the Catholic Board says that the ministry approved their plan to have itinerant teachers rotate through this many schools. The province doesn't allow PSWs to work at multiple facilities, so I'm just wondering why it's okay for teachers to.
We have a very high and strict protocol for students in the province of Ontario. They can have a direct and indirect contact of up to 100, which is lower than BC at 120. We've asked those educators, itinerant, a synonym would be like a French teacher, for example, or a music teacher, specialized teacher, where there will not be a teacher per class. They're usually providing 1 hour of instruction to those children, for example, in French class. The protocol requires that school boards work to limit the mobility, limit the movement of that staff member between schools, really reducing that from, let's say, years prior. We've also enhanced the screening protocol for those very individuals. And I will note that, you'll remember, Chris, a few months ago, and I say this very respectfully, but we had asked for some flexibility from our teacher union federations on the issue of prep time. If we had that flexibility built in, we could bundle the prep time, we could start it earlier at the end of the day, reducing the requirement on these specialized teachers coming in, thus relieving the homeroom teacher to take their prep time. This could have been avoided. And so we're now working with our teacher unions, the local is in Toronto District School Board, with their local union partners to find a resolution. And I hope we can do that. We really seek to reduce the risk. We're informed by Dr. Williams, the Chief Medical Officer, and if any guidance or adjustments are recommended going forward, we will absolutely adopt them as we have at every step of the way.
Follow-up?
Thank you. And I know you said that you want to avoid shutting down the school system, but I'm just wondering if there's a point at which you have to, because of high transmission levels, either within schools or because of transmission in the community. What numbers do we have to see on a consistent basis when you would consider doing that?
We obviously, I'll turn the question to Dr. Williams in the context of sort of the broader decision points on closures or opening. But what I can tell you is this province is committed to keeping our schools open. We have an obligation to our young people, to our society, to our working parents, to the mental health of our kids, to keep them in school. We have to do everything we can to reduce the risk. And the reason why the Premier has made this announcement today, an additional $35 million targeting the highest risk communities of Toronto, of York, Peel, and Ottawa, is because we seek to avoid that scenario. We want to really help reduce that risk within those communities where we've seen higher levels of community transmission. And this investment is going to help hire upwards of 400 new teachers, an additional 600 custodians. It could help procure more than 70,000 computers. And if we triage and focus on those high risk communities and improve the layers of prevention within them, we really think we could help reduce that risk. But I'll turn it to Dr. Williams for further.
So Minister Lecce has covered many of the main factors that are there. If you're asking system-wide, is a different question that we've been going through the process now of looking at different classrooms and different schools and dealing with outbreaks and concerns at that level. That's combined, of course, with our ongoing issue of managing community activity of coronavirus, and we continue to monitor the data basically on a provincial level, but more detailed down to health unit and then down to different neighborhoods and areas with the participation of our public health officers. At the same time, our medical officer of health, even in Toronto, they're concerned with keeping the schools open. They know the need of it. They've seen the data, they've seen the information. So we're going to work hard to make sure our schools stay open before even getting close to talking about system-wide issues, because system-wide issues would mean large provincial activities and things far more than we've seen up till now. So these are all things we'll monitor, we'll keep an eye on, we'll be advised by our local medical officers, their data and their information to give us direction and to assess the situation in Ontario. Classroom, school, areas, as well as system overall. So as the minister has alluded to, many things are in place to monitor that, to curtail it and limit it as soon as possible. And with our medical officer of health in the province who are determined and very concerned about keeping our schools open, of course, with the safety of children and teachers and everyone in mind.
Next question.
Next question comes from Rhonda Rath from Sage TV. Please go ahead.
Hi, Randy.
Hi, everyone. This over the weekend, Andrea Feller, she's the associate medical officer of health in Niagara, tweeted about COVID, and she said that we should, if you show the modest symptoms, you should self-isolate. You should get tested. You should make sure that your workplace screens. That you should stay away from crowds, wear a mask, keep 2 meters away from everyone. And she said, don't go to Toronto, Peel, the GTA, or Ottawa. Should people avoid going to Toronto and those communities I just mentioned?
I'll pass that over to Dr. Williams.
So as far as any internal provincial travel restrictions, we have not put those in place. We know that our areas in Toronto and Peel and Ottawa are having issues at this time, and we're continuing to monitor that. We have asked people to, even in their current situation throughout the province, to decrease travel in sense, don't go to your house if you don't need to go out. Don't go moving around, even if in other parts of the province. So that's just more limiting your social contacts at this time. As far as any travel bans around those areas, we have not put that in place. We're saying again, if you need to go to a place like Toronto, Peel, or Ottawa, that whether you was now or even a month ago, you would maintain your proper social distancing, masking, don't go if you're sick, all the things we messaged before. That's not related just to specific to those areas, especially if you're moving around, even if you go from Niagara up to Waterloo or to London or other places as well. So those things are still in place. And if you do and you have to travel for essential reasons, you don't lax those methods of vigilance that we've asked for all along. So again, you have to do your masking, you have to do your hand hygiene, you have to do your staying home. Don't travel if you're ill. And determine what that purpose of that trip is, and to curtail that this time, especially if you cannot maintain any of those functions in your travel plans. So not an official one, but unofficially, you have to be very judicious about your choice of when to travel and where to travel.
Follow-up.
Yeah, about the testing, particularly the lab, how did we arrive at a position in this province where the labs are seemingly overwhelmed and it takes them so long to process results?
Yeah, so Randy, the numbers yesterday are still upwards to close to 40,000, so they haven't slowed down on the testing. I think there were 38,000. But at the end of the day, Randy, there's only so many lab technicians. Let me repeat that: diagnostic lab technicians in the province, and we're reaching out to everything from the colleges and universities to the private sector labs, and obviously right across the government as well. And then there's a shortage on reagent right across the world. I've talked to Ronnie Miller over at Roche. He texted me this morning. But this goes back to my comments for the last couple of weeks about the rapid test, the antigen test, the rapid test. It's going to be a game changer. I understand Health Canada is moving forward on that as quickly as possible, and hopefully in the next couple of weeks or sooner, we should have some positive news. Just imagine, Randy, you're going in there, and we all know this isn't 100%, but at least it's a good screen. If you're going into somewhere and within 5 minutes, you can find out either going in or you're going out. One of the two, but it's just going to be a game changer. It's going to be a massive game changer if we can get this approved. And then once we get it approved, the question is, the big companies like Roche, like Apple, not Apotex, Abbott, when can we get it? It's one thing to get approval, but we need the goods. We need the goods, and then the distribution too. We have a good plan for distribution. And as for the testing, over a very short while this week and next week, we'll be adding upwards to another 100 pharmacies. So we aren't holding back. We're moving forward in a very aggressive way.
Next question.
Next question comes from Colin DeMello from CTV News. Please go ahead.
Hi, Colin.
Hi, good afternoon, Premier. The Ontario Long-Term Care Association recently told the Commission of Inquiry that they alerted your government back in January that nursing homes simply were not ready to deal with COVID-19. Premier, when did you personally, sorry, that's my son behind me. When did you personally find out about this warning from the Long-Term Care Association, Premier?
Well, I believe, first of all, our guidelines came out at the first week of April. That doesn't mean we weren't thinking about it right from the get-go, from the time actually we got elected. It was the only premier in the history of this province that has dedicated someone to long-term care, a full ministry. So we were moving forward the whole time, right from January, February, and prior to that too, and fixing long-term care. We know it's broken. It's been broken for decades. And we're doing everything we can to make sure that we correct any issues that have brought forward and that the commission is going to bring forward. But we're being proactive. I can't wait for the commission to give their report, which I'm in favor of, but we have to start moving forward, and we're going to continue having announcements about protecting the long-term care.
Follow up.
And a follow-up question to Dr. Williams. Dr. Williams, it really seems like the spread of COVID-19 is a bit out of control in Toronto, Peel, and Ottawa. There is a recommendation to you from Dr. Eileen de Villa in Toronto to restrict indoor dining until the province gets a handle of this. I'm wondering, are you looking to move any of these regions or recommend that the government move these regions back into stage 2?
So we had discussions at the end of last week with mostly with Dr. de Villa, also with Dr. Etches in Ottawa, to discuss how their process and the cases and the increasing numbers were concerning them. We are reviewing their data, and last week we did, on Friday, we put in the measures that the cabinet had approved around restricting indoor dining numbers, the 6 to a table, the distancing, the watching the lineups outside, in the people waiting to come in. We've talked about reducing the banquet convention center down to a total of 50 in institution to cover that off as well as we continue our methods of decreasing on social gatherings and groups as before. So I know Dr. de Villa was concerned that you want to take even more extensive measures, as noted in her communications. In that, we had said we will continue to look at that with our public health measures table. We want to see what the impact was thus far with the processes put in place. We're continuing to ask them to give more data to make sure that it supports any further steps so we can handle that. And then looking at aspects of what can they do in Toronto, what can we do, what can they do in Ottawa, and different steps that sometimes are noted in our HPPA, that's the Health Protection Promotion Act, what local medical officers can do, and what we can do as a province, and what I can do as the Chief Medical Officer of Health. So we're trying to put all our things together to understand how best to handle these big surges that they're seeing in Toronto and Ottawa at this time, to give them the best capability they can to respond and to deal with it in a way that meets the needs and is targeted, but at the same time protects the public writ large, not only from COVID, but from other issues as well. So we want to be very careful in how we handle that. But we're seeking and having ongoing discussions. I had another further long talk with Dr. de Villa this morning, and we'll continue to have those discussions to come up with what's best that we can help them with, and we can do from a provincial side, and they can do from a local, municipal, local health unit side. So those discussions are continuing.
Next question.
Next question comes from Natasha MacDonald from Radio Canada. Please go ahead.
Hi, Natasha.
Hey, Premier. At the TDSB, there's hundreds of students in French immersion that have been assigned English teachers. In Ottawa, French schools have resorted to begging parents to fill in as substitute teachers. Your government waited until last week to announce new measures to hire more French teachers. What do you say to parents who feel French language education, especially during COVID-19, is not a priority for your government?
Well, it's a high priority, and I'll pass it over to the Minister of Education.
Hi there. Well, just to build upon the Premier's point, I mean, it was this government during the negotiations with our French language unions who agreed to create a French second language working group, which, yes, we reestablished last week. This was not an issue as a consequence of COVID. It's been an issue for us for over a year of discussions with French language boards, parents, students about the national shortage of French language teachers. I've met with the Consul General of France as well and foreign governments to see in the Francophonie how we could attract qualified educators from French language nations to come to this province and teach. We also face recruitment from other provinces trying to poach some of these incredibly talented people. So we are doing everything we humanly can, knowing our requirement and our obligation constitutionally to French language minority education. We're proud of it. It is a model in this country with very high outcomes, and we'll continue to be there for French language educators. It's the basis for why we've created that working group. It's why we brought union boards and all parties together. And I think we're going to see some positive results about how we can work to increase supply, an issue that is not unique to Ontario and an issue that precedes the election of this government. But we know it's a problem, and we're going to help work hard to fix it.
Follow-up?
My follow-up is about pharmacy testing. So you're talking about adding 100 pharmacies next week. Most pharmacies offering testing in the GTA anyway either have an unavailable number where you call them or a 1 to 4 week wait list. And each pharmacy is doing maybe 50 tests a day. People are still calling confused as to whether they can get tested there. So my question is, how useful really has been this pharmacy testing strategy so far, if at all? And are you dissatisfied at how it was rolled out?
No, I think I'm very, very satisfied. We're upwards close to 100 now. We're going to add another 100. And just keep in mind, talk about success. We're hammering the whole country combined. All the provinces combined can't even keep up to us. We have tested over 4 million people. And when we get the approvals from Health Canada, the antigen test, we can implement that as well. So I want to thank the pharmacies. And again, you can go get tested, especially if you're out there and you're concerned, get tested. But we always emphasize, if you don't show any symptoms at all, please don't get tested. Let the people that are showing symptoms get in front of you. Let the emergency service folks get in front of you, the long-term care, the frontline healthcare workers. That's what we're looking at to have the pharmacies support us. And I think as they're ramping up, it's relatively new, they're going to do an incredible job as they have out in Alberta. The system's working. So we're going to continue on with the pharmacy.
Next question comes from Crystal Oak from Global News. Please go ahead.
Hi, Crystal.
Hi, my question is for Premier Ford. So you ordered testing centers province-wide shut down for 2 days to reset for online bookings. Ottawa stayed open yesterday with no clear communication about why, which caused a lot of confusion. What do you think about that, and do you know what happened?
Well, I'll pass this over to the Minister of Health. Thank you.
Well, the units were to be closed to anybody who's a walk-in, but anybody who already had a test appointed or set up, which is happening in most of our northern assessment centers now because of the weather conditions, mostly getting colder. And that's what we wanted to have happen in York, Ottawa, and Toronto. Peel and Toronto, sorry, to make sure that people, if they already had an appointment, they could go in, but there were no walk-ins that were meant to happen there to allow time for the systems at the hospitals to readjust so that they could start booking clients and people to come in online as quickly as possible, because we know, as bad as it is to have to physically wait in line to receive a test, waiting on the phone for a few hours is no better. So that's why we made that change to allow for that transition at hospitals. And we anticipate that all hospitals will be available to online appointments as of tomorrow.
Follow-up?
But yesterday, Ottawa clinics were taking walk-ins. So I guess my question is, what do you think went wrong in terms of the communication there? Because there was quite a few clinics who weren't sure and a lot of people who also weren't sure.
Pass it back to the minister.
I would anticipate it's because there were people that were showing up with symptoms that needed to be tested immediately. And so, you have a rule, but if there's someone there that has significant symptoms and needs to be tested, that they made the accommodation to do that, which is in the interest of everyone's health and safety.
Last question.
Last question comes from Sean Jeffords from the Canadian Press. Please go ahead.
Hi, Sean.
Good afternoon, Premier. I wanted to follow up on a comment you made just a little while ago at the press conference about the lab processing capacity in the province. Over the weekend, Toronto Public Health said it would stop contact tracing except in high-risk cases, and that their current approach was unsustainable. I'm wondering if this is in some ways linked to what you've just identified, the idea that, frankly, we have reached our capacity in the province to process tests. And I'm wondering what the province is doing about that.
Well, right now, as I mentioned earlier, we have an issue with getting enough diagnostic lab technicians. We're reaching out right across the province to every avenue we can. There's also a worldwide shortage on the testing mechanisms. And so we're working with Roche, we're working with Abbott, we're working with the federal government to see if we can get these rapid tests. It's going to be an absolute game changer. And what we need the data, and I always make a judgment on evidence-based. And that, as for any region that's seeing a spike, be it Ottawa or Toronto and London, or I'm sorry, or York and Peel. And if there's a request to shut down restaurants, I have to sit back and look at evidence. And when I rely on the command table that is made up with a lot of bright doctors and also public health officials are sitting around there, and I can't see the evidence, I go back to, these are people that have put their life in these small restaurants, and they put everything they've had. And I have to make sure 100%, I've proven before, we will do it in a heartbeat, but I have to see the evidence before I take someone's livelihood away from them and shut their lives down. That's a huge decision that weighs on my shoulders and our team's shoulders. And it's tough. We're looking at restaurants, the vast majority, the overwhelmingly vast majority are following the protocols. We put in additional guidelines by making sure that when you're going into a restaurant, there's 6 to a table, that we get contact information for every single person. We've reduced the hours of serving alcohol. We've shut down strip joints. We've closed bars earlier. So I want to exhaust every single avenue before I ruin someone's life. It's easy to go in there and say, I'm just shutting down everything. Show me the evidence, hard, concrete evidence. There's thousands of small mom and pop shops. I'm not talking the big conglomerates. I'm talking these people that have put they're your neighbors, they're your friends, they're your family members. That weighs on you. I have to have a balance before I destroy someone's life. You better show me real good evidence before we do it. The easy thing to do is, without seeing endless data, is just close everything down. Well, I'm sorry, I'm not prepared to do that to people's lives right now. I've proven if I have to do it, we'll do it in 10 seconds. But show me more evidence. Show the health table, the command table, more data. And that's why it's so important to collect this data. It's absolutely critical. I can't make a willy-nilly decision and just say I'm closing everything down and ruin thousands and thousands of people's livelihoods and their life. So show us the evidence, hardcore evidence, put it in front of the command table, because again, I've said, it's not just Dr. Williams making this decision. We have chief medical officers from an entire province looking at this. And what they're coming back, we need more data. We need more evidence. We just can't pick a few. We've asked the Minister of Labor to ramp up the inspections to these restaurants, and we're going to go after the bad actors, and we're going to shut the bad actors down. But these restaurants, and I'm sure you went into restaurants, I have, they have been following the guidelines, have been putting up barriers, they're putting up masks, they have hand sanitizer, they're separating their tables by 6 feet. And because we have some bad actors, I'm going to demolish people's lives. I'm not prepared to do that right now, unless it's just hardcore evidence. It's widespread across an industry. Picking on restaurants, it's just not the avenue that we want to go down.
Follow up?
Premier, I wanted to ask you as well about the rapid changes in rules and guidance that we've seen over the last 2 weeks. You know, obviously the situation is changing very quickly, but are you concerned that people have, frankly, they're not really understanding what the province is trying to communicate any longer, and that they're tuning you out?
Well, I totally disagree with that, because I'm out there and I'm talking to the people. Do you know what it comes down to? Is over the last couple of days, as you're getting a message from municipalities, maybe the hotspot areas, you're getting a message from the province, you're getting a message from the feds. And yes, do we all have to make sure we're on the same page and communicate? Yes, 100%. Are we collaborating? 100%. I just got off the phone with Mayor Tory. We're collaborating. We want the same message out there, but really what it comes down to is, you know, use your best judgment. I've got a lot of calls. Should I go see my 80-year-old mother for Thanksgiving? It's about, you have to use your judgment. You have to use common sense, and that really comes down to your family members. Do we want you to tighten the circle? 100% we want you to tighten it. Do we want you to stick within the same group that you're always around, be it family members? Absolutely. And I think people know that. I don't think, you know, you could be any clearer. Tighten things up. Did things get a little loosey-goosey? Yeah, they did. People were going out there. They were getting in large gatherings. And did some people let their guard down? Absolutely, they let their guard down. But now, folks, we have to tighten it up. It's about as clear as I can be. So I'll pass it over to the minister. Thank you.
Well, we are asking people just to use their judgment. Their rules are out there, but I think if you take a look at your own family situation, especially with Thanksgiving coming up next weekend, then you want to make sure that if you have any very vulnerable family members, people over the age of 70, or people that may have pre-existing conditions, you may not want to get together with them to protect their health and safety. The same thing, don't get involved in large groups. 20, 30 person family dinners are not what we should be doing right now. We need to just really stick to our close household unit so that we can flatten the curve and get out of this second wave. It's not going to be forever, but we do need to take these precautions now so that we can get through all of this together and we can go back to living lives more, I won't say as normally as we did before, but with similar precautions in place. But just please follow the public health rules. I think those are the rules that will continue to guide all of us. And if you do that and apply it in your own family situation, I'm sure everyone will have a great Thanksgiving and do everything they can to keep their family members safe.
Thank you.
Thank you.
Thank you.